Hi there. This is the second of the two videos about the summarising, signposting, acknowledging. This one we're focusing on clarifying the issues that need to be dealt with in a more complex consultation. So this can be any consultation where it's more than just finding a diagnosis and a management plan. It doesn't have to be super complex. It might be that plus they need there's an issue with work and they need a sick note. Or it might be other end of the spectrum where there's masses to do. Maybe there's more than one presenting complaint given, and one of the presenting complaints have multiple factors to it. There's problems with work, sick note, they want another medicine prescribed, and you're feeling overwhelmed. You're thinking, well, where am I going to start with this? And you're not sure where you're going to start, and you might get lost in the in the data gathering because you'll forget which bits you need to do. It might be hard for the patient because they might really want to talk about their work, but you feel you need to talk about the making the diagnosis, and you're trying to ask about the symptoms, but they keep telling you about social things, and it can go round in circles and feel very confused. You can get to the end and feel, I'm not sure what's happened there. So by clarifying the issues, you're giving a structure. You're stating your hypothesis on what you think it seems the patient wants and what you need out of this consultation. The patient can then confirm or deny those are the things they need, and then you can clarify, signpost what you're going to go to next. It gives you a structure then throughout the consultation. So if we looked at example, so we might say, so it sounds to me, and in that way you're showing this is my interpretation, but feel free to interrupt. So it sounds to me like we need to look at your work situation and maybe sort out the sick note for you. We need to work out how we're going to notify the hospital consultant about what's been going on. I would like to ask you a few more questions about your symptoms just to check we've got the right diagnosis. You wanted some more painkillers that were prescribed a couple of months ago, and you also wanted to ask about the eye problem that started a couple of days ago. Is that correct? Great. Okay, so what I'd like to do is look at your symptoms first, if that's okay. Great. So what I understand, and correct me if I'm wrong, and then you can go on to summarise. So you kind of clarified. This is normally when we talk in the last video talking about summarising. We've clarified the issues, and then I've signposted. I'm now going to talk about this section, and then I've summarised, and then would go from there. And that then enables you, if there was, let's say, a patient started talking about their work situation, you can obviously allow them to talk, try not to interrupt, but enables you to bring it back and acknowledge, no problem, we will be sorting that, we will look at that in a minute. Just wanted to check again, so I asked you about the how long it's been going on for. Can we just talk about that, and you can bring them back to the section you need, provide some organisation to the consultation. You can obviously, if it's a complex consultation, you can define the issues at the management stage as well, which is important to do. But if you can do it early, it enables the organisation for the whole consultation. If we didn't do this, and you may feel, well, I'd rather kind of concentrate on the medical side, and hopefully the patient might forget some of the bits they've said. It's all very well, but if you get to what you think is the end of the consultation and the patient brings up a task that hasn't been dealt with, you've then got a chunk of history and management that still hasn't been done. And on the other side, the patient may say, actually, I don't need any help with that, which then shortens the consultation down. So you're very unlikely to gain time with this because you'll be more organised and you're covering all the things that you and the patient wanted anyway, and you're more likely to gain time because it may be that things aren't needed. So if our patient in this example had said, actually, I'm seeing the consultant tomorrow, so you don't need to tell the consultant, and I'm happy to go through the symptoms with them. I'm really just here for that painkiller and the sick note. You've just brought down this consultation from a 20-minute to a 5-minute consultation. So I'd advise, look out for any consultation where it's more than just diagnosis management. Maybe simple, just a sick note as well, and just have a practice at clarifying what you're going to be doing in the consultation, then signposting, this is what I'm going to move on to next, and then summarise for that section and see how you get on. And hopefully the more you practice, the technique, even with simple consultations, the easier it will be when it's more complex ones. Yeah, I think that was it. Okay, well, good luck with that.